Hello, my name is Christy, and everyone knows the story about the birds and the bees, and we all know that the babies are dropped off on your front porch by the stork. So the story goes. But when we grow up, find the one we love, and decide to add to our family, we realize it may not be that easy. Today I'm going to inform you about the cause and effect of infertility. I've completed research about infertility. Centers of Disease Control and Prevention 2019 stated that, in general, infertility is defined as not being able to get pregnant, conceive, after 1 year or longer of unprotected sex. Because infertility in women is known to decline steadily with age, some providers evaluate and treat women age 35 years or older after 6 months of unprotected sex. Who can be affected by infertility? What are the causes? And how is infertility tested and treated? Infertility is considered after a couple has been actively trying to become pregnant for at least a year if they are under the age of 35, and only 6 months if they are 35 or older. Some women can even become infertile after already having children. Infertility does not discriminate and can affect anyone at any age, although women who are older have a higher chance of becoming infertile. According to Medline Plus 2019, after 1 year of having unprotected sex, about 15% of couples are unable to get pregnant. About a third of the time, infertility can be traced to the woman. In another third of cases, it can be because of the man. The rest of the time, it is because of both partners or no cause can be found. When should you see a doctor about infertility? According to Mayo Clinic Staff 2019, a woman should see a doctor if she is 35 to 40 years old and has been trying to get pregnant for 6 months, over the age of 40, has irregular menstrual cycles, painful periods, known fertility problems, diagnosed with endometriosis or pelvic inflammatory disease, had multiple miscarriage, or undergone treatment for cancer. For a man, you should see a doctor if you have low sperm count or problems with sperm, history of testicular, prostate, or sexual problems, if you've undergone cancer treatment, have had testicles that are small in size, swelling in scrotum, or if you have other family members with fertility problems. But what are the causes of infertility? In order to become pregnant, the sperm must meet and fertilize the woman's egg. It then must implant into the woman's uterus to begin growing. There are many factors that may prevent this from happening. Thankfully, our medical field is able to do certain tests to try and find any issues with our bodies that could prevent us from becoming pregnant. When the man meets with a fertility specialist, they will take a sperm sample and analyze it. They will be checking for sperm count and quality. Affiliated physicians stated, if a semen analysis is found to be abnormal, generally it is first repeated to confirm the abnormality. Once confirmed, the male partner is referred to a reproductive urologist, especially if the abnormality is severe. In some cases, the reproductive urologist can improve semen function by recommending certain lifestyle changes, by hormonal treatments, or by surgery. Other causes can be from cigarette smoking, alcohol, and drugs. Some medications, like antibiotics, can also affect fertility. Extreme heat can cause low sperm production, for example, hot tubs and hot showers. For a woman, she needs to ovulate and release an egg to be fertilized. Typically, a woman will only release 1 egg a month, compared to a man who will release thousands at a time. Since the woman is the one carrying the baby, there are a lot more things that could go wrong for her. Some causes of infertility that a woman may experience would be ovulation issues, which affect the release of the egg from the ovaries. Some women may not ovulate each month, which can cause irregular periods. Some women may have a condition called endometriosis, which is tissue growing on the outside of your uterus instead of the inside, which may need to be surgically removed. Endometriosis can cause the lining of your uterus to be too thick, and the fertilized egg is unable to attach to the uterus. Some women also have polyps or cysts on their ovaries that they may need to take care of before they are able to become pregnant. Another cause would be early menopause, which is the menstruation ends before the age 40. If you're not menstruating, then you're not releasing an egg to be fertilized each month. Certain diseases can also affect women's fertility, such as diabetes and some autoimmune diseases. Now that we discussed infertility, we will talk about testing and treatment. Testing and treatment are very important parts to overcoming infertility and becoming pregnant. Early detection can help with finding the problem and start treatments if they're needed. Both the man and the woman would want to go through testing because both parties can have a problem or just one of them, but testing would be able to figure out the issue. A male needs to be producing healthy sperm, so the semen analysis would determine the sperm count, how healthy the sperm is, and will most likely be the first step. They also might have a hormone test by blood ordered to see what his testosterone levels may be. If you have low testosterone, your body may not be making enough sperm. If you're taking additional testosterone, for example, being on testosterone replacement, your brain is telling your body that you have enough testosterone and your body will stop making sperm, causing a low sperm count. Now for a woman, her ovaries need to release healthy eggs because they will need to travel through the fallopian tubes all the way to the uterus to be implanted. You can also have your blood drawn to check your hormonal levels. Your hormones also play a big part in being able to conceive. Believe it or not, your thyroid also can affect your fertility. Your thyroid produces hormones which help with releasing a woman's egg. If your thyroid is not producing enough hormones, it will affect the release of their egg. You can also check your fallopian tubes for any blockages. All of these have their own treatment plan and would need to be followed. After testing to determine the problem, you're able to come up with your treatment plan to become pregnant. If you're unable to determine any issues with the male or female, you may consider other options like adopting. Men can change their lifestyle by exercising more. They may take medications that can improve your sperm count. As a couple, try improving frequency and timing of intercourse. There are many ovulation calendars that can be downloaded onto your phone that can track the woman's period, can estimate when she will be more fertile. They also have at-home tests that you can take to determine if and when you're ovulating. Treatment for women can be medication called Clomid, which can help stimulate ovulation, or trying intrauterine insemination. Intrauterine insemination is when the doctor will take the male sperm and place it directly into the woman when they believe she'll be ovulating. They do a lot of monitoring to determine when this will happen and make sure they have it timed right. Couples may end up trying more costly route, which is in vitro fertilization. In vitro fertilization is when they physically take the woman's egg and take a man's sperm and join them together in a lab. They will allow them to meet. Then they will implant the embryo into the woman's uterus, where it will hopefully implant and continue to grow. Most couples will save in vitro fertilization for a last resort because of it being a more costly procedure and invasive. We have specifically looked at who can be affected by infertility, what can cause it, and how it's tested and treated. I hope I've successfully informed you about the cause and effect. And even though you may not be personally affected by infertility, you most likely know someone who has been affected, even if you don't know it. It's a lot more common than most people think, and it can affect anyone at any point in their life.